My name is Nenad and I'm one of the partners at the Barn Equine Surgery. The Barn Equine Surgery is a 100% equine practice on Dorset, Hampshire border and has been established since 1950s. We are self-sufficient, fully equipped, 100% equine practice, able to provide care of your horse regardless of what the requirements are. We are fully equipped in diagnostic imaging, including radiography, ultrasonography, and nuclear scintigraphy, commonly known as a bone scanning, as well as a surgical procedure, and can take on any orthopedic or a soft tissue surgery. We take care of emergencies, we can deal with colic surgeries, we deal with reproduction, or any medical investigation necessary. We have 12 stables, therefore we are able to hospitalize patients should that be necessary, or keep them with us for the prolonged investigations. We have a full-size menage that we can use for wettings. We often use it for investigation of poor performance, written assessments, and all the other procedures necessary. We have been using nuclear scintigraphy, or commonly known bone scanning technique, at this practice for over 10 years and have recently upgraded our equipment to the state-of-the-art system. We find scintigraphy extremely useful for investigations of back pain, pelvic pain, or issues that are not necessarily clear-cut on the x-rays or diagnostic analgesia. We often use it as a means of trying to identify where the source of pain is coming from, because some horses are not amenable to multiple nerve blocks or injections. Initially, we decided to set this up as a self-sufficient system for our own cases. However, as this has developed and enlarged, we're very happy to look after our own clients, but we also offer a referral service to local and neighboring practices. The way we arrange bone scans at the Barn Equine Surgery works as follows. We would ask the client to bring the horse in the night before. Horse would stay with us for the night, so we know we are up and ready to go the following morning. The morning of the scan, we would exercise horse for about half an hour just to increase the body temperature and make sure circulation is working very well. After that, we put the horse in a surgical stocks. We will clip the left-hand side of the neck, place a jugular catheter, and inject technetium-99. As soon as the horse has been injected, we would bandage the lower limbs and put the horse back in the stable. After about 2.5 to 3 hours, we'll bring the horse, take the bandages off, bring the horse in the scintigraphy room and start scanning. We usually start acquisition from pelvis and see if the bladder is empty so that we can get images of that difficult part of the body. If it is empty, we'll continue with back, and then depending what else we're scanning. If the bladder is full and we can't get a good quality images, we'll concentrate on the lower limbs before returning horse back to the stable to urinate and empty its bladder, and then finishing the scan afterwards. Our current system, which is any scan system that we got from Bartek, it's a brand new camera head with advanced software. And when we compare to the previous systems, we are finding that it has revolutionized our imaging capacity, because not only we get a much better images, we can do scans much quicker, and we can carry out the full body bone scan in about 2.5 hours, which is almost half a time what we used to do in the past. Getting this system has almost reignited our enthusiasm for scintigraphy, because there is nothing worse than having to repeat images over and over again and spending 6-7 hours in a room with a horse, because by that stage everybody is getting a bit tired, everybody is getting a bit fed up, horse doesn't want to stand still, and nowadays we can do that in no time at all, knowing that the imaging quality will be second to none. Camera comes with amazing software that would analyze and put images together, so we know what quality image we have as soon as we finish acquiring it. It has automatic motion correction, which helps us a lot, because obviously sedated horses would not necessarily just move, but they always sway from one end to another, and without motion correction software we would struggle to get good quality images. I am absolutely delighted as a partner in charge of scintigraphy that what we have at the moment, and would not have any hesitation recommending Bartek to anybody who is thinking either upgrading their current system or installing scintigraphy from scratch.